Yeah, that'd be brilliant.
Okay.
So just like paint a picture.
Okay, so I'll kind of start with what I think basically it is. So I suppose nurses are kind of the middleman sometimes.
Between the patient and the doctor?
Yeah.
Yeah.
So, for example, say a patient's feeling sick, we spend a lot of time with them.
Okay.
The doctor isn't there as much as like we're with them, obviously. So they either come to us and tell us, or say if I'm noticing my patient's acting a bit down or different, I'd be able to ask if anything's the matter.
Okay.
So if they're feeling sick, I'm gonna go talk to the doctor and either try to get them to, I don't know, change the medication if that's what the cause is, or give them some antiemetics. So it doesn't seem like it, but all of that requires effective communication.
Yeah, definitely. Does it happen quite often? Like, do patients consult with you? That.
Well, yeah, because you build that rapport with them, so, and I suppose that's part of communication as well.
Yeah.
And like we want to have the empathy towards the patients, to be able to make them feel comfortable as if they can tell us that information, and
I think like that'd be a huge like part of being a nurse, wouldn't it? Being empathetic.
Yeah, and I think like you want to advocate for your patient. So if there's something wrong, like you want to be able to find that out and go and talk to somebody to help them and make them better. Even if it's just feeling sick, that you don't want them to be feeling sick all day. They're already sick.
It's like their satisfaction is what you need.
So like on the opposite kind of to that, sometimes when the doctors go and talk to them, the doctors tend to talk a bit medically.
Yeah, definitely.
Like they didn't understand everything.
I've had that like personal experience.
Yeah, exactly. So like you can go. Sometimes I tend to like just go in after and kind of see what the doctor said to them, and if they've got any concerns, usually they'll say them. Or if they seem a bit confused about what they're saying, then I'll just try to clarify that for them.
Yeah.
But yeah, they want to know what's going on with them.
So that's like very verbal sort of communication.
Yeah, so you've got non-verbal as well, I suppose. Like for instance, you don't want to go to work looking like you haven't slept.
Yeah.
I don't know if that would give the patient much confidence in you.
Yeah,
so that's
definitely.
Pretty simple. Like you also want to be able to show the patient that you do care. You don't want to be short with them, or you can get frustrated if they're not understanding something because they haven't studied for years. They don't understand everything.
Yeah.
You can't get mad at them for not understanding some things.
Yeah.
We have to have the patience and be able to communicate effectively with them to help them understand what's going on. And I think that's very important.
Definitely.
Yeah, so like advocacy is important, I think, with communication, because you are advocating for your patient to make sure they get the care they need, and good care.
Yeah.
Empathy.
Empathy would be a huge one, wouldn't it?
Yeah, because you want them to feel like that you care for them,
yeah,
and that you're caring and doing the best you can for them.
From what I've read so far, like in like literature, a common theme is that empathy underlies everything. That's what the patient wants to. They want you to.
Well, I'd imagine even if I was a patient and on the opposite side of it, I wouldn't be too confident in telling the nurse anything if they were not very approachable.
Yeah.
And that's, yeah, so...
have you had any sort of like first-hand experiences of like how communication is vital, especially in the surgical ward? Because I imagine that would be a very, very different to being in sort of...
Yeah, they're all different, I suppose. One I can really think about is, it wasn't in my grad year, it was when I was on prac. I was in a paediatric ward. I had a little boy, and he had a tumour, and they weren't able to operate on it. So he was in for quite a while, and the whole thing was we really were trying to communicate with the parents, because they obviously had a lot of concerns, and that would be quite a shock, I would imagine. And so you had to have the patience and understanding and empathy towards the family to be able to explain to them like what was going on. Like we were still giving him medications and checking his OBS and stuff, but we weren't treating the tumour type thing. Like that, I suppose that would be difficult, and they were wanting to know what every single medication was, and that's fair. So you just had to use effective communication, and you had to make sure both verbally and non-verbally it was done well.
Yeah. So it's not even the patient that you're focusing on the patient, but you've also got to consider the parents.
Yeah, in a pediatric setting, so that sometimes can make it a bit more